which explain the mucolytic properties of licorice mentioned in traditional Persian medicine. Glycerza glabra extracts have also shown cardioprotective properties both in vitro and in vivo via improvement of endogenous antioxidant defense mechanisms. In addition, it has improved sirtuin-1, a cardioprotective transcription factor, and decreased the release of CKMB and LDH, which are the integrated. Recently, we conducted a clinical trial on a herbal medicine inspired from traditional Persian medicine and mainly consists of licorice. The herbal medicine was formulated in the form of syrup named licoherb and standardized based on glyceric acid. The design of a study was a multicenter, open-label, randomized controlled trial. And hospitalized patients with COVID-19 diagnosed by PCR or lung CT and have oxygen saturation lower than 93% were enrolled in the study. The trial was conducted at 3 medical centers from 19th of March through 2nd of May. Patients were randomly assigned to receive either Ricoher plus standard care or standard care alone for 7 days. Several clinical and paraclinical outcomes were evaluated. The Ricoher could reduce severity of symptoms including fever, cough, headache, and dyspnea. Moreover, it reduced the length of hospitalization and the number of patients referred to ICU. The statistical analysis of data has not finished yet, and so I cannot represent the precise effect of Licoherb on paraclinical outcomes. The next plant I chose is clove. The flower buds of clove are mostly known for their use as an analgesic and antimicrobial in dentistry. In traditional Persian medicine, it has been claimed to be useful for cough and dyspnea and have cardiotonic and renal protective properties. Different extracts of clove have demonstrated antiviral activity against herpes simplex virus 1 and 2. One of its active chemical compounds, eugenol, exhibited antiviral activity against influenza A virus through direct reduction of viral replication as well as inhibition of autophagy, which results in acute lung damage. Clove has also demonstrated immunomodulatory effects in animal model of immunosuppression. 1 week administration of clove essential oil potentiated both humoral and cell-mediated immunity. Clove has a flavonoid called biofluorine with remarkable anti-inflammatory activity. Its rapid anti-inflammatory activity by single dose administration suggesting biofluorine as a fast-acting agent that may be useful in emergency acute inflammation, such as a cytokine storm in SARS-CoV-2 infected patients. Moreover, the aqueous extract of clove demonstrated protective effect in animal model of infectious pyelonephritis, a condition which has been reported in COVID-19 patients. Let me talk about another useful medicinal plant, galangal. Galangal is a plant from Alpinia species that its rhizome used for medicinal purposes. In traditional Persian medicine, it has been claimed to have lung protective activity and useful for cough and dyspnea, and also have renal protective effects. The most important category of chemical constituents in this plant are the aryl heptanoids with remarkable anti-inflammatory properties. The aryl heptanoids from galangal showed remarkable in vitro antiviral activity against different viruses, especially against several types of influenza virus. Galangal also represented the protective effect on murine model of influenza. It is worth to mention that molecular docking analysis showed the effectiveness of galangal compounds against SARS-CoV-2. Some compounds isolated from galangal, including acetoxy, cavicol acetate, and galangin, have demonstrated protective effects on lung and reduce eosinophils infiltration and pro-inflammatory cytokine secretion in mouse model of asthma. It is surprising that the effect of 15 milligram per kg of galangin was equal or higher than 3 milligram per kilogram of dexamethasone. Acetoxy-cavicol acetate has also shown immunomodulatory properties in murine-stimulated macrophages. Cardioprotective and renal protective activities of galangal were demonstrated in animal models. And the last plant I chose is rhubarb from the genus Rheum. Several species of the genus Rheum are commonly consumed as rhubarb. Moreover than its purgative activity, it has been considered as a lung tonifying agent in traditional Persian medicine and useful for dyspnea. Rheum palmatum extract has demonstrated antiviral activity against Coxsackie virus B3, the main reason of viral myocarditis. Moreover, Rheum species, including Rheum palmatum and Rheum officinal, inhibited the activity of three main HIV-1 enzymes. Rain, one of the main components of rhubarb, has shown protective effects in respiratory syncytial virus-induced lung infection via modulation of inflammatory responses. It is amazing that rain at a dose of 120 milligram per kg showed a similar efficacy to 46 milligram per kg of ribavirin. In both in vitro and in vivo models of pulmonary fibrosis, emodin caused a decrease in alpha smooth muscle actin and collagen production. In a randomized controlled clinical trial in patients with acute respiratory distress syndrome, a life-threatening condition which is also observed in COVID-19, a liquid rhubarb preparation was administered via nasogastric tube for 1 week. Compared to the control group, it could significantly improve the oxygenation and decrease extravascular lung water index as well as pulmonary vascular permeability index. Emodin atrial natriuretic and natriuretic peptide, a molecular secreted. This is a molecule secreted by cardiomyocyte with a multi-targeted role in cardio protection. The aqueous Rheum palmatum extract and rain demonstrated nephroprotective activity in cellular and animal models of chronic kidney disease. There are other medicinal plants in traditional Persian medicine since they have confirmed pharmacological activities in modern medicine. Further preclinical and clinical studies are required to be conducted to serve precise mechanisms of action as well as their efficacy and safety in patients with COVID-19. Thank you very much for your attention.
Dr. Rahimi,
Yes.
please unmute. Yes.
So, thank you very much for watching my presentation. If any question, I'm available in chat for answer them. Thank you.
Thank you, Dr. Rahimi, for your nice presentation. We will start the next presentation. My dear friend, Dr. Ahmed Muslimoglu, please connect and share your slides, and we will enjoy your presentation. Dr. Muslimoglu, do you hear me?